So, good evening. I am Dr. Shopano Shah, currently attached with Medica Super Specialty Hospital, Kolkata, working there as a consultant pulmonologist and critical care specialist. So, today we are going to talk about one of the very important and common disorders that affects the people in our country, that is asthma. So, a lot of different taboos, a lot of different myths associated with the disease. So, what I'm going to do is we are just going to give a brief overview of what is basically asthma, what is the treatment, and how to diagnose asthma, and what are the precautions that one should take. So first of all, what is asthma? Basically, asthma is a condition, it's a respiratory disorder, it's a disease which affects the respiratory system, the lungs per se. The airways of the lungs are affected. What happens is the airways get inflamed and there is excessive deposition of mucus, because of which the airways get narrow and breathing becomes difficult. So this is a very simple thing. So what happens, many triggers are there which can provoke asthma, like it is more common in winter season, or it can also happen due to exposure to pollen, dust, and others, pet fur, or other many dust, pollen, pet fur, other chemicals. Or even one more important thing in our country is pollution. Pollution is very important in our country. That is a major factor. Second one more is after pollution, that is one more important factor for asthma is the cold weather, the season change, and the seasonal flu infections. That is especially during the months of winter and during the months of rainy season. That is the time when flu affects many people. So the asthmatic patients, they tend to have a worse outcome with flu. And these are the triggers of asthma. These are the things which can exacerbate the asthma patient. So what happens is that the normal patient, asthma patients, they are more sensitive to these triggers. So in these patients, when they are exposed to such conditions, they will have worsening of symptoms. So coming to the symptoms, what is symptoms of asthma? So mainly the patient will present with symptoms like cough, which has been going on for a long time, which is not decreasing despite taking cough syrup and other medication, despite taking antibiotics. The cough can be productive or it can be without production, that is dry cough. Along with this, the patient will also have shortness of breath, which will happen when patient is doing doing some physical activity like walking up the stairs or doing some heavy work. That time patient will feel that he's having shortness of breath, and this will gradually increase over time. Another thing, that important thing that symptom is chest tightness. The patient will feel that chest has become very tight and he's unable to breathe properly. The fourth thing that can happen is sneezing. These patients, when they are exposed to the cold weather or dust, they can sneeze a lot, and a lot of watering also can come from the nose. Another one is the sound, that is known as wheezing. That sound will come. The patient will, if the patient will be able to hear it, or patient's attenders will hear it when the patient is sleeping. There is some sound like a whistle will come while during breathing. This is because of the airways getting blocked, and the air cannot travel through that blocked airway. So there's a whistling sound comes during the expiration. And other symptoms also, these are the common symptoms of asthma. And another thing in asthma is that the patients will have these symptoms will not be present throughout the year. Sometimes patient will be good, like during the summer season the patients might not have any symptoms, but when the winter comes, so when he is exposed to some cold, dust, or he is exposed to some water, then the symptoms might exacerbate. So asthma patients, the important point is that these patients will not be bad throughout the year. They will have times when they are good, and there are times when they are bad also. So it will be waxing and waning. Sometimes the patients will be good, sometimes they will have symptoms. And now coming to the diagnosis of asthma. So diagnosis per se means the important thing is the symptoms. Along with that, we do a test, there is a spirometry or pulmonary function test, which will give us an idea about how severe the asthma is and whether it is reversibility is present or not. And other ancillary tests that can be done are blood tests, including it might show an increased level of IgE. That is, they will show that these patients are allergic prone, so they have high Ig levels and high eosinophil levels in the blood. And also some patients in the blood reports, they might have increased infective markers like increased total counts of CRP. And very important thing about asthma is that if these asthmatic patients, if they develop any fever or any viral infection that is very common during season change, in that time their symptoms may get increased. So these patients will come with increased shortness of breath, cough, wheeze, very common during winter season and season change. There is known as exacerbation of asthma. That is, basically a patient had asthma, but because of the trigger factors like fever, it has got increased, and now patient is coming with increased symptoms. So again, very important thing about the myth. Another thing is coming to the treatment. Main treatment of asthma is inhaler. So very important thing to remember is that inhalers are not something that is harmful for the body. Many people think that they are taking inhalers means they have to take inhalers for life, and that might harm them. That is not the truth. Actually, inhaler basically contains the medication which will help in controlling the symptoms of asthma. If you don't take the inhaler properly, you will continue having symptoms, and they might increase and they might lead to other complications. So inhaler is very important mainstay treatment of asthma. It basically contains a medication in aerosol form which will go to the lungs and which will help in that which will reduce the inflammation and swelling and also help in coughing out the secretions. That will help in clearing the airways and the reduction of symptoms. So inhalers are the mainstay of asthma, and so patients should not have any doubts like they are not any harmful things, or they are not some drugs which can cause side effects. This is basically a medication that is important for asthma. And one more thing patients to remember is that even if they are taking the inhaler, if they are feeling that okay, after 1 week I am having symptoms are gone, they should not stop the inhaler abruptly, because it can lead to again reappearance of symptoms. So at least for asthma what we say is that patient has to take the inhalers for at least 2 to 3 months depending on severity. If it is severe, then has to take it for a long time, but if it is non-severe, you can take it for 2 to 3 months, especially in the winter season and during the triggers, and then you can decrease it, but should not stop inhalers abruptly without consulting doctor. Also another thing is that patients should be very aware, and they should refrain or should not have any cold items like very cold water or cold items like cold drinks, ice cream. And also they can sit in air conditioned rooms, but the temperature should be kept around 24-25 and with the fan speed at medium. And also they should not be exposed directly to the AC or the fan wind, because if they are exposed directly, again symptoms will increase. They can sit in AC rooms, but temperature should be above 25. And also when they are taking a bath, should not take bath for a long time, or should not wet the hair for a long time, because if these same things, then they'll increase the symptoms of asthma. Also when they're doing any work, if people who are having asthma are exposed to dust, they can have increase of symptoms. So in this case, the symptoms should not, because of this, they should take adequate precaution like wearing mask, or in sometimes they can have to change the job also if they are exposed to a lot of dust, because dust, cold and smoke, these three things are very important triggers. And if patients are exposed to these three factors, even if they are taking medication, still the symptoms will persist. So many patients come to us with, despite taking inhaler, we are finding that still they are having symptoms. Then it is found out that they are still exposed to these kind of things. So these kind of things, patient has to be very aware. Should not be exposed to much dust, cold or smoke. So if any dust like activity is going on in the house, you should wear a mask. And also keep the bed sheets and bed covers clean at all times, and periodically should clean the room, and there should not be any dust or any mold or any smoke in the room. The room should be free from that. Another important thing about asthma, is that the inhaler should be taken on a regular basis and not stopped abruptly without consulting the doctor. And also if you are having increasing symptoms, you should immediately consult your concerned chest physician and get this treatment done, and should not take any medications on their own. Another thing in asthma is that if any patient having asthma is developing shortness of breath, or you're feeling the patient is being drowsy, that is, he is not responding properly, or he is feeling sleepy, or he's like his normal levels of activity have come down, so that is a very bad sign, which means the patient might be having an increased deposition of carbon dioxide in the airways, which is causing the drowsiness. So at that time, immediately you should shift the patient to the nearest emergency, get everything, get the workup done, get the patient admitted. So if any time the symptoms are increased, if it is not controlled at home, if the patient is having low saturation, or if he is having increased shortness of breath, immediately you should take the patient to the nearest emergency, so that emergency drugs can be given and the patient can get some relief. So basically it is asthma is very common, and treatment also is very simple. So basically what we need to do is we need to be aware of the symptoms. Patients need to be aware of the symptoms, and they should report it immediately and get it checked and get it treated, because many times what happens with patients, they think that these symptoms are due to the cold weather or due to the old age. So many times they ignore the symptoms. This leads to delayed treatment and more complications. Also, two important things you should know about asthma, and the important thing is vaccination. So these patients, they are more prone to flu or flu-like infections, which in these patients can cause increased problems like increased shortness of breath, can even lead to pneumonia, can even lead to increased stay in the hospital, ICU stay. So what happens if the patients take this vaccine? There are two types of vaccines. One is pneumococcal vaccine, which is to be taken every 5 years, and one is the influenza vaccine. So in our country, in India, the best time to take the flu vaccine is every September onwards. That should be taken. What will that help in? It will help in reducing the exacerbation. So if any patient even gets the flu, he will not have much increasing symptoms. So all patients with asthma, irrespective of severity, should receive a yearly flu vaccination at least. And those who are having asthma above 60 years of age, in addition to flu vaccine, they should also take the pneumococcal vaccine, which is important for them. And also should take medicines regularly. Another important thing is how to take the inhaler. There is a proper way of how to taking it, because if you are not taking inhaler in the right way, then the drug will get deposited in the mouth and resulting in fungal infections. So you should take inhaler always with the help of spacer device, and not directly. If you take the inhaler directly, what will happen is that even if you press, the medicine will not get deposited in the lungs, it will get deposited in the oral cavity and resulting in, one is symptoms will not come down, second you have fungal infection. So if you always take it to a spacer device. Nowadays what is there is that many of the inhaler packets, they are having a QR code, so you can scan the QR code and you can easily see the steps how to take the inhaler. And another important thing is that you should always wash your mouth, gargle after taking inhaler, and then throw the water away, because this will help in clearing the deposited drug in the mouth, so there is less fungal infection. That is a very important thing to remember. And technique is also very important. So always you should get the technique checked with your nearest doctor, or if he is having many companies like Cipla, Lupin nowadays, they will have this thing. Then they can help the patients. That is very important. So basically, the patient should be more aware of the symptoms. They should report it promptly, get the treatment done, and most important, they should stay adherent. They should not discontinue the treatment even if he is having no symptoms. Because maximum time in India, what happens is the patients, whenever they are feeling okay, they will stop taking inhaler and they will not stop coming to the doctor. Again, what will happen is same patient after 1 month, 2 months will come back with increasing symptoms. This happens because the patient is feeling that okay, I am very okay, now I don't need to take the inhaler. But that is actually not true. The inhaler needs to be taken for at least 2 to 3, maybe 4, 5 months, maybe more. So you should only stop taking the inhaler if your doctor says that it is safe to stop the inhaler. So basically, this inhaler is the mainstay of asthma medication treatment, which should be taken regularly on a proper basis. Thank you.